Hi everyone. Happy Wednesday. We'll wait just a second so some people can hop on. If you're joining us, say hi. Let us know where you're watching from. Hey, Susan. Carrie. Nikki. Lisa. Charlie. A good group today. What's it? All right, everyone, we're going to go ahead and get started. We have Dr. Tony with us today, and he's going to talk about ulcer management. Be sure to get any questions that you have for him in those comments. We are going to give away a Valley Vet gift card at the end of the segment, so you want to make sure that you get your comments in there so you have a chance to win that. So with that, we're going to turn it over to Dr. Tony.
Hi folks, hope everybody's doing well today. As they mentioned, today we're going to talk about ulcers, gastric ulcers in horses. And it looks like we've got a pretty good group. As always, if you have any questions, please leave them in the comment box and we will address those as they come up. So yeah, gastric ulcers. It is a very common problem. Some prevalence estimated at 50 to 90% of horses are affected by gastric ulcers at some point in their life. So chances are, if you have horses or you've been around horses, you at least know about the problem, if not having a horse that's been affected by it. If you're not aware of what they are, gastric ulcers, they're kind of self-explanatory. It's an erosion in the lining of the stomach. So the stomach has protective lining over the surface of it, and stomach acid, if it's not properly neutralized or buffered, can erode holes and sores into that surface of that stomach. And so that can potentially turn very serious if it's not treated and addressed. So the reason this happens is horses, they're not like us. Their stomachs produce acid continuously, even when they're not eating. Whereas when we eat a meal, our stomach secretes acid, but it doesn't do it unless we eat. Horses are continuously producing acid, and they were created so that they would be continuously eating, grazing grass. And so that feed stuff and that saliva that's produced from chewing would buffer and neutralize that acid. And so you can understand that if we are feeding our horses meals, then that stomach acid that's being produced can sit in that stomach and cause some issues. So that kind of leads us into some of the risk factors. And as I mentioned, meal feeding is a big risk factor. When we feed these horses 2 meals a day, then there's long periods of time where that acid is just sitting in the stomach, potentially causing problems. Another big risk factor is not meal feeding. I already said that. A high grain diet. And the reason for that is that as these grains are digested, they produce some acidic byproducts. And so these acids could potentiate stomach acid, make the environment more acidic, lower the pH. So if we're looking to minimize the risk of stomach ulcers, then addressing that high grain diet would be a good step to take. Athletes, horses that are athletes in racing or endurance or even show horse at risk. Any kind of stress, such as stress from transport or stress from being confined in a stall, is a risk factor. And finally, some medications that we commonly give horses are a big risk factor. Think steroids and some anti-inflammatory pain medications such as Bute, Banamine, or Equiox are the most common ones. So those are the big risk factors. Ulcers are inherently difficult to diagnose, to pick up. The reason being is that a lot of the symptoms are subtle. And so especially if we see these horses every day, a lot of these behaviors or symptoms that they pick up from their stomach ulcers, then we can just attribute to a normal horse behavior, when in fact it could be a symptom of a disease. Let's look at this comment here. It says, my mare got ulcers from stress. Mountain lion attack during a fire on the mountain, and I shortly had to move her. She also witnessed my other horse's death due to the mountain lion attack, so she has been prone to ulcers ever since. Yep, that's a good point there. That's a lot of stress to put that animal through, and so stress can sure potentiate the risk of ulcers. So some of the symptoms that we see, like I said, very subtle: a poor appetite or picky eater, and poor hair coat or just a dull hair coat, behavioral or attitude changes, mild weight loss, cribbing or wind sucking, decreased performance, reluctance to train, and then low-grade colic or recurrent colic. So as you can see, a lot of these are difficult to pick up, and we may miss it. Levothyroxine, can it cause ulcers? No, thyroid medicine does not cause ulcers. So that's not a big concern when taking that medication. Levothyroxine is a medication for horses that have hypothyroidism, and it's a replacement for that hormone that they can't produce naturally for themselves. So that being said, if a case of ulcers progresses to a serious level, then you're not going to miss the symptoms. It's going to cause some severe stomach pain, going to cause severe colic, grinding teeth. Your horse might lay on its back more than normal. That tends to give them some relief. So you're not going to miss those symptoms. Lisa asks, are weanlings or yearlings prone to ulcers also? And yes, they are. Any age group can get ulcers. And young horses, especially foals, if they get any kind of illness, it's safe to assume that they have ulcers as well, just from the stress of the disease. So it can affect horses from birth all the way till elderly geriatric horses. Good question. It's difficult to diagnose. The only way to really diagnose it for sure is to scope the horse, where your veterinarian passes an endoscope down into the stomach and visualizes the surface of that stomach to look for any ulceration. So it's expensive. It's minimally invasive in the grand scheme of things, but it can be kind of a pain to get done. So there's really no downside if you're suspicious that your horse has ulcers to go ahead and run a treatment course. Even if the animal doesn't have any ulceration, then it's not going to cause any harm to treat them as they do. So that being said, treatment, in addition to the medications that we use, there are some management changes that we can institute to try to help minimize the effect of the ulcers and help clear them up. So really the only medication that we have available for treatment is Omeprazole, and the brand name of this is Gastric Guard or Ulcer Guard. They contain the same medication. Gastric Guard is the prescription form, and it is labeled for treatment. Typically, depending on the weight of the horse, it's 1 tube once a day for at least 28 days in a row. Ulcer Guard is commonly used extra label as a treatment. And it has the same exact concentration and amount of omeprazole that Gastric Guard does. And so after speaking with your veterinarian, then you can use that extra label as a treatment for ulceration as well. But Ulcer Guard is labeled over the counter, and it's labeled as a preventative, 1/4 to 1/2 a tube once a day for prevention. So one of those two medications, omeprazole, is the best treatment that we have. Like I mentioned, there's some other things that we can do, and that would include feeding hay 24 hours a day or leaving pasture access available so those animals can be grazing continuously. Or if that's not available, then at least feeding multiple meals a day, at least 3 to 4 meals a day, so we can try to keep feed stuff in that stomach as long as possible. Reduce the training intensity if your animal's a performance horse. If that's an option, that would help. And then also discontinuing any medications that can potentiate stomach ulcers would help immensely. There are some supplements or medications that are also labeled and intended to coat those ulcers to provide some relief and to help it heal up. Sucralfate is a prescription medication that your veterinarian can prescribe. But one over-the-counter supplement that does similar functions as the sucralfate is called Alamind, and it comes in a liquid. And when your horse consumes this, it forms kind of a barrier on the surface of the stomach so that those acids cannot continue to attack the surface. It coats those ulcers, provides relief for the animal, and it also helps it to heal up. So that's a good thing to add to. It's kind of an adjunct treatment to the omeprazole. Let's see, I think we did have some questions pop up there. Maybe not, mostly some comments. Okay. Nikki commented, I found changing my boy's ulcer meds every few months has kept him comfortable. Okay, that's good. So we kind of commented on treatment of ulcers. Now we can sure talk about prevention of the ulcers. Continuous access to hay and pasture. And a lot of these are going to be similar to the treatment recommendations that we made. So continuous access to hay and pasture. And alfalfa is especially good for ulceration. It's got high levels of calcium, which can serve as an antacid. And so it does help with ulcerations and prevention of ulceration. So throwing some alfalfa into the hay mix is a good thing if you're trying to prevent or treat ulcers. And again, if you can feed at least multiple 3 to 4 meals a day, that's going to help prevent that development. Reducing the grain levels is huge. And if your horse is prone to ulcers, that's going to be a big way to minimize that acid in the stomach. So if your horse needs the energy, is that why you're feeding grains, then you can replace that energy level with high-fat supplements. And we have plenty of those. Weight Builder by Farnham is a good one. We have a senior weight accelerator product, and those high-fat products give us a lot of good calories for weight building and weight management, but it doesn't make them hot and it doesn't predispose them to ulcers or laminitis. So those are some really good options. Decreasing NSAID usage, our bute, banamine, Equiox. If we can wean these horses off of those medications, then that's going to be a big step. If we need the pain control, many studies have really shown that our devil's claw and I lost my train of thought here. Devil's Claw Yucca, that's the word I was looking for. Devil's Claw Yucca, like Devil's Claw Plus or Buteless. Those products provide really good pain control and is very comparable or even better than some of the pain relief we get from Bute. So that's something to think about. If you have a painful horse, try those supplements out and you might be happy with the pain control you get and able to wean them off of that Bute. Limit the intense training, limit the transport if at all possible. That's going to be a big potentiator. If they're stalled, you don't have a way to turn them out, provide socialization so they can interact with other horses, provide enrichment so they don't get bored, and leave continuous access to hay. So now we can sure talk about some supplements. They're going to help a lot. If these horses are prone, we have lots of good options for supplements that's going to help prevent these ulcers from developing. So the most basic one is just an antacid, similar to Tums in people. It really just neutralizes that acid that's in the stomach, and so that it raises the pH so that those ulcers can't develop. We have a couple of products here, and one is called Ulcer Guard. I'll show you the label here. That's a really good product to use. It comes in a pellet, so the horses like it. Another good one that I commonly recommend is called Command Ulcer. And so those are going to be a couple of examples of products that are just straight antacids. We need to feed it multiple times a day to really help neutralize that acid. And so I recommend that you divide the daily dose into 2 and feed it at least twice a day. Tammy asks a good question. Are the feeds that now contain an ulcer supplement good to use? Will they help minimize the ulcers if a horse is prone to them? For the most part, Tammy, yes, they are good to use. Most of them have those antacids included in them. And so it does do a better job of neutralizing that acid. Is it safe to feed GastroFix daily as preventative for a single horse in a dry lot? GastroFix. I'm not completely familiar with that product. Do you maybe mean Gastric Guard, the tube paste? If you could comment again, Vicky, and clarify that. If not, I'll look up the GastroFix because I'm not familiar with that product. Typically, yes, you can feed these supplements on a regular basis long term, and it's not going to cause any harm. Okay, Purina Outlast. Yeah, that's a good product to use. And then another question. So add to feed. Elizabeth asked to add to feed, and yes, those supplements that I just showed, the U-Guard, the Command, you would add those to the feed, or the U-Guard's a pellet, and so depending on the horse, they might eat that on its own. But yes, you would either add that to feed or feed it on its own. So GastroFix from Blue Bonnet. I would have to look that up, Vicky. I'm assuming it's going to be okay to feed it every day. The only one that I wouldn't recommend feeding every day for long term is a product like Gastric Guard or Ulcer Guard, just because that Omeprazole is such a good potentiator of minimizing the acid production, and that acid does play a vital role in digestion, and so we wouldn't want to minimize that acid production for long term. We really just want to do it as needed on a preventative basis for Ulcer Guard or for treatment. And then we switch to these supplements that are safe for long-term usage. Good questions, good questions. Please keep them coming if you got any more. So another product that makes a really good supplement to prevent these ulcers is a product called Alamin. I mentioned this earlier for treatment, and it comes in a liquid. Now what this does is it coats the stomach. It doesn't affect the pH of the stomach, and so it does a good job of protecting that stomach surface from the acid while allowing the horse to continue to produce acid. So the company says that it does a much better job of enhancing digestion while also protecting the stomach, and it looks like this. And similar to that, you just add it to the feed daily, and it does a good job of preventing that ulcer. Would aloe juice or aloe pellets be a good preventative? Good question, Susan. I've never heard or seen any data on aloe being used for ulcer prevention. So I would steer you more towards some of these supplements that we're talking about. Familiar with CEP products like Gut Check? No, I'm not off the top of my head. I can look up some of these products, but I'm not familiar with those ones. Okay, good questions. A lot of good product questions, and I will do my best to. These comments are going to stay on our Facebook here, and I'll look some of these products up, and I'll come back and comment on them. So be sure to check back if you want to see the answers to these. So the last one that I'll talk about is called Succeed. Let me grab that here, and this is what it looks like. It comes in a meal, which is this, and it also comes in a pellet, which comes in a much bigger box. But that's an excellent supplement, and like the other ones, a great preventative for ulcers. The difference of Succeed and why it's very popular is because it addresses the full GI health, not just the stomach. And investigators are starting to realize that hindgut ulcers and disease is becoming recognized more and more commonly. And so Succeed does a good job of addressing the entire tract from the stomach all the way to the hindgut. And that kind of leads us into this question: best way to heal hindgut ulcers. And this is going to be many of the same things. So that grain that we were talking about with stomach ulcers, as that passes through the tract, those volatile fatty acids that are produced are going to be continued to produce in the hindgut. And so taking those grains out of the diet or minimizing it is going to be a big step for minimizing those hindgut ulcers. Ulcer Guard, Gastric Guard doesn't work well in the hind gut. So if you know your horse has hind gut ulcers, you can use them, but it's only going to affect the stomach. So these diet changes and minimizing stress, turnout, multiple meals a day, or constant access to grass, those are going to be your big contributors to treatment. And then that Succeed is going to be an excellent thing to add on for that hind gut health. Charlie asks, are you familiar with Zestera? And again, no, I'm not. There's just so many products out there that I just don't have any experience with some of the ones that you're asking. Succeed, safe for daily use. Yes, it is. It's very commonly fed every day, all year long, and it's a really good product. So one last thing that I will mention about some products is that Ulcer Guard. I've brought that up a few times. And when we talked about stress, we talked about transport, we talked about shows, stall confinement. If you are not able to take those out completely because your horse is an athlete and that's what your horse does, then we can use this Ulcer Guard during those periods of stress. And it's a very, very effective preventative. So if you know you're going to transport your horse, have Ulcer Guard on hand and give that product to prevent those ulcers from really developing during periods of intense training where you're really putting your horse into some intense periods of activity. Give that Ulcer Guard once a day, and it really does a good job preventing those ulcers from developing. Any further questions? That's kind of all that I had. Geraldine asks, what about a horse that has restrictions from too much grass, especially in the spring? And that's a good question, Geraldine. So I'll kind of elaborate on that a little bit. She's asking about, I'm sure if you guys are familiar with horses, you know, but during the spring and fall, sometimes too, depending on the climate, these grasses have really high levels of sugars. And so it can predispose horses to laminitis, or horses that have insulin resistance can have some issues with handling that. So it's recommended to limit their intake of grass, of that green, nice grass. If you have a problem with that with your horse, what you're going to want to do is use hay, use dried hay. And so the non-structural carbohydrate or sugar level is lower. And you want to make sure to feed that lower sugar hay, but you still want to provide multiple meals per day. You can use other higher fiber sources. Beet pulp is a good one. And you can try to feed multiple meals during the day if your horse is sensitive enough that you can't feed hay continuously. My horse has been by himself for almost 2 years and is obviously lonely. Can that cause ulcers? Yes, it can predispose to ulcers. So if your horse is a social animal and it's stressed enough that you can tell that that animal is lonely, then yes, that is a big cause of stress. And so it's just something that you're going to have to be aware of. You could either try to add an animal or try to socialize your animal, or just be on the lookout for any symptoms of ulcers that we talked about. Providing some enrichment from some toys or activities to do, that often helps with some of those lonely behaviors. Well, guys, I appreciate all the questions. It really helps. And I will go through and I'll look up all those products and I'll do my best to answer your questions about them. If you have any further questions, please put them in the comments and I'll address those as well. I think we had one pop up here, or maybe a comment. My sucralfate powder to keep on hand. And yeah, we mentioned that earlier. That helps to coat those ulcers. A mini pony for company helps too. And so I think that goes back to the last question we had about that lonely horse. So, okay, well, I hope everybody has a good day. Thanks for stopping on, and stay tuned because they're going to announce the winners.
Alrighty. right, thanks everybody for joining us. We have a winner to announce here.
All right, so the winner of the gift card is Tammy Frith. Congratulations.
I think I hit myself with that one. Just a few announcements for you guys. Don't forget about our Positively Awesome giveaway going on now. This ends May 27th. So if you haven't signed up for this, please go get signed up. We're going to have 5 winners and each one will get a $100 gift card.
And our Spraymaster Spectacular is still going on, and this one goes until June 24th. So make sure you get signed up for that as well.
And join us again next Wednesday. We will be live with Horseware Ireland at 10:30.
It's 10 or 10:30. It's different than our normal time,
little
so
different.
make sure you sign up to get the notification on the events tab.
All right. Well, thanks everybody for joining us.
Thank
Thank you,
you.
Dr. Tony. We'll see you next week.
See you guys.